Today was my first day of practicum with my first session, and so I kind of wanted to share my experience that I had going into it as a grad student that is getting her degree in clinical mental health counseling. Now, I didn't really get a lot of training before, or I felt just like so unprepared. So what I did is I let myself have a layout of like what I was going to talk about, and I structured my session. So I talked about confidentiality, just going over that, introducing like kind of who I am, and discussing that I am a counselor in residency is how I described it, and what my supervisor recommended me to do. So I did that. Um, and then I kind of went over a biopsychosocial assessment that the practice that I am interning under required. And so that kind of helped me. But I think like some tips that I think would help people that are barely starting their practicum, or I wish somebody would have told me, is that one, to like your main goal, like during intake session, is obviously to try and understand and get to figure out what the problem is, like how you can help this client. But I think the number one thing is making sure that you are looking and like wanting them to be there. Like I have a resting mean face, and so something that I wish somebody would have told me is be aware of like being, nice, and making sure that you're like giving the correct emotion for what they're describing, because I think that the more I imitated the emotion that they wanted me to perceive, I guess, or like they wanted me to have, they began to open up more, if that makes sense. And not necessarily like they were like, that's not what I meant. I just meant that like I should have been more focused on in the moment and like wanting to be present with my client. And so I guess my number one is be present. It is hard because you're trying to like write down everything, you're trying to make sure that you're saying everything correctly, but I think like really like you're wanting to have a therapeutic relationship between the counselor and the client, and that is what is going to make the client come the next week. It's not going to be about the questions you ask, but it's going to be about how you ask them and about how you represented yourself to them. You are wanting them to come back, and so the best way to do that is be present with them and what they're struggling with, or whatever the case may be. And so I guess my number one tip is be present to, if it doesn't, if it goes a certain, if the conversation is not going a direction that you want it to go, I feel like that's fine, because whatever the client is going through, they're trying to process it, and eventually what they're describing, you are going to be able to put it in your intake, if that makes sense, or that's what helped me. And so I guess my second thing would be at ease with maybe the certain direction. You are not in the intervention yet, you are just getting to know this client, and so there's less stress in the certain like theoretical orientation or modality that you're going to use. So try and be at ease with that and keep that in mind. Number three is make sure that you know what you're getting into. I think something that I didn't know like half the things, and I started my session, like I obviously finished my session and I did my session, but I guess what I'm saying is ask all the questions that you need to ask before the intake session, because my first session, my supervisor was not getting back to me. I didn't really have anyone to answer the questions that I was still questioning before I started. And so make sure you have all your questions asked and you're confident enough to walk in there like not worried about like a certain outline or what note taking or whatever, let you know everything before, because I didn't. And so yeah, that was just my process of today. I feel really good about my session. I hope my client comes back next week. I want to work with some things and I feel ready and prepared, and so I'm just excited. And yeah, thanks for watching.